You hear a nurse talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good afternoon, Mihiraa. I'm Nurse Marcus Major. How can I help you today?
Hello, nurse. Thank you for seeing me. I've been having a lot of trouble with my throat lately.
I'm sorry to hear that. Let's start by getting some more details. How long have you been experiencing this pain?
It's been about a week now, but it's gotten worse over the past couple of days. At first, I thought it was just a cold, but the pain didn't go away. It's really uncomfortable, especially when I swallow.
I see. Besides the pain, have you noticed any other symptoms? For example, fever, difficulty swallowing, or changes in your voice?
Yes, actually, I've had a fever on and off, and it's been hard to swallow anything, even liquids. My voice has become a bit hoarse, too. I've also been feeling really tired and run down.
That sounds quite unpleasant. Have you had any issues with your tonsils before, or is this the first time you've experienced something like this?
I've had a few sore throats here and there, but nothing like this. I had tonsillitis when I was younger, but I've never had this kind of pain or swelling as an adult.
Thank you for sharing that. Let's talk a little about your medical history. Do you have any other chronic conditions or take any medications regularly? Also, is there any family history of throat issues?
I don't have any chronic conditions, and I'm not on any regular medication. My mother did have her tonsils removed when she was about my age because she kept getting this. Other than that, there's no significant family history of throat problems.
That's good to know. What about your lifestyle? Do you smoke, or are you exposed to any secondhand smoke? And how is your diet and overall health?
I try to eat a balanced diet and stay healthy. But I've been so busy with work and the kids that I've probably been neglecting wellness a bit lately. I don't smoke or drink alcohol, and no one in my household does either.
I understand. Stress and fatigue can sometimes make us more susceptible to infections due to suboptimal health habits. Now, have you noticed anything specific that seems to make the pain worse or better? For example, certain foods, or maybe resting your voice.
Drinking anything cold makes it worse, and spicy foods are just unbearable. Warm drinks like tea seem to soothe it a little, but it's only temporary relief. Resting my voice helps a bit, too, but I can't do that all day.
It sounds like you're doing what you can to manage it, but it must be difficult, especially with the swelling and difficulty swallowing. Based on what you've described, it does seem like you might have an infection, possibly tonsillitis.
That's what I was afraid of. What should I do next? I can't bear it any longer.
Warm saline gargling a few times a day can also help soothe your throat. I recommend starting with some over-the-counter pain relief, like paracetamol or ibuprofen, to manage the pain and reduce the inflammation. We'll also prescribe you an antibiotic if it turns out to be a bacterial infection.
Okay, I'll try that. But how will I know if it's bacterial? And how long do I have to wait?
We'll need to do a throat swab to test for bacteria. I'll schedule that for you, along with some blood tests to check for any underlying issues. In the meantime, try to rest, stay hydrated, and avoid any irritants like smoke or strong smells.
That sounds good. I really hope it helps.
I'm sure it will.
Thank you so much, Nurse Major. You hear a doctor talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I see you've booked an appointment because of some issues with your leg and hand. Can you tell me a bit more about what's been happening?
Good morning, doctor. Yes, I've been experiencing some weakness in my left leg for the past few days. It's gotten to the point where I sometimes stumble when I walk. And more recently, I've started feeling numbness in my left hand, particularly in my fingers. It's very worrying.
I see. And you mentioned feeling short of breath as well.
Yes, that's correct. It's not all the time, but occasionally, especially when I'm climbing stairs or even walking short distances. It feels like I can't catch my breath, and my heart starts racing.
That sounds concerning. Can you describe in more detail how you're feeling now? Have you tried any remedies or noticed anything that makes it better or worse?
Right now, the weakness in my leg is still there. It's not constant, but it comes and goes throughout the day. The numbness in my hand is pretty consistent. I've tried massaging it and keeping my hand warm, but nothing seems to help. As for the shortness of breath, I've tried to rest more and avoid exertion, but it doesn't always help. I just feel like my body isn't responding the way it should.
That must be very frustrating. Let's go back to when these symptoms first started. Can you tell me about the onset? When did you first notice the weakness and numbness, and has anything changed since then?
It started about 2 weeks ago. The leg weakness was the first thing I noticed. I thought maybe I'd strained a muscle or something, so I didn't pay too much attention at first. But then it didn't go away, and last week, the numbness in my hands started. That's when I really got worried. The shortness of breath started a few days after the numbness. It's all been building up, and I'm not sure what's causing it.
I understand. Let's discuss your medical history. Have you had any other health issues recently, or are you currently taking any medications?
Yes, I've had a few health issues over the past year. I was diagnosed with hypertension about 6 months ago, and I'm taking amlodipine for that. Other than that, I've been relatively healthy, but these new symptoms are really worrying me. Oh, yeah, I also have a history of migraines, for which I've been prescribed sumatriptan.
Thank you for sharing that. Let's proceed with a physical examination. I'll start by checking your reflexes and muscle strength in both your legs and arms. After that, I'll listen to your heart and lungs to assess your cardiovascular and respiratory systems.
Okay, let's do it.
Based on what I'm seeing, there's definitely some weakness in your left leg, and the numbness in your hand is noticeable as well. Your heart sounds normal, but I can hear some slight irregularities in your breathing. I'd like to do some further tests to get a clearer picture, but my preliminary diagnosis is that you may be experiencing symptoms related to a neurological issue, possibly related to a pinched nerve or something more systemic.
I see. That sounds serious. What should I do next?
For now, I'm going to prescribe a mild pain reliever and a muscle relaxant to help with the leg weakness and any associated discomfort. The medications will be ibuprofen for pain management and baclofen for muscle issues. However, this is just to manage your symptoms for the time being.
And what about long-term treatment?
We need to get to the root cause of these symptoms. I'm going to refer you to a neurologist for further evaluation, which may include an MRI scan and nerve conduction studies. Depending on the results, treatment could range from physical therapy to more specific interventions if a neurological disorder is confirmed. In the meantime, it's important to avoid strenuous activities that could exacerbate your symptoms.
Thank you, doctor. I appreciate your help. I'll make sure to follow up with the neurologist as soon as possible.
You're welcome, Mihiraa.
That is the end of Part A. Now check the answers.